Hi, welcome to Module 2, Conception, Heredity, and Environment. So the first thing I want to point out is that generally when we talk about the environment, people think we're talking about the home situation or the neighborhood or actual environmental toxins in the air or whatnot. But when we're talking about child development, the first environment is in utero. So there's a lot of important things that happen as exposure right from pregnancy inside the uterus on that absolutely affects things later in life. So you'll learn about some of those. So in this module, it's going to be a little bit of a review of what a high school sex ed class at the beginning. So please watch and enjoy The Great Sperm Race. It's a funny and fabulous illustration of exactly what happens in conception. Then we'll move into a discussion about infertility and how it's unfortunate that there's a large number of Canadian couples who are unable to conceive if they want to. I personally have a number of friends who waited like professional women waited longer, and as you see, age is a big factor, and they're having difficulty conceiving now that they've finally gotten into a stable relationship and are financially stable and careers are going well. But unfortunately, biologically, they were actually more fertile if they were to get pregnant in their late teens, early 20s, when it wasn't necessarily as socially ideal for them. So that's a new issue that's facing our society today that we'll look at. Then there's a discussion of heredity, which is kind of a review of grade 12 biology class in terms of genetics. So make sure you're familiar with all of those things. And the discussion question and something to keep in mind as you go through the module is, how much would you like to know? Our science and technology has really developed in such a way that we can find out a lot about our own genetics, our own risks, as well as the risks of passing on potential abnormalities to children. But do remember that it's only potential, that almost none of these tests, there are some, I think there might be one that is 100%, but generally speaking, we're talking about risk for, as opposed to you are definitely going to conceive a child that has X. So how much of that information do you want to find out? Do you think it is responsible to do genetic counseling in order to find out what the risk is of having a child with whatever? Or would you like to leave it as centuries and centuries of people have done, up to chance, and are willing to care for whatever infant comes your way? So enjoy this module, and I'll see you next time.